line around those monitors that indicated potential problems. And it looked to me as though that dashed line surrounded all of your monitors. Do you have any monitors outside that dashed line so you can be sure that those limits are accurate?
There have been some PDK logs run on water supply wells over on the dome. We're honestly evaluating the utility of those, whether they'll show gas to the south, to the north, and to the west. No.
So you haven't really necessarily defined the limits of the danger zone?
That's correct.
Okay. My other question has to do with health. Is your health expert available for questions tonight?
Someone with DHH here?
Well, perhaps I could just ask the question and then maybe somebody on the team can answer it. I was on the Bayou Corne and Grand Bayou today, and the stench from the sinkhole was strong enough to cause nausea, coughing, and stinging eyes. I'm sure many of the residents have experienced the same for some time now. That's not a dangerous level necessarily for a very brief exposure. It's the sort of thing.
Is that a question?
Yes. Yes. Because the question would not be understandable without this. It is a dangerous level for chronic exposure. I'm a biomedical scientist. I know what I'm talking about. The question is, what kind of medical monitoring has been placed in this community by a dependable and respectable organization?
That's really a question you can ask someone afterwards, because there's nobody here to answer it. Right.
Nobody here in the community knows whether there's a medical monitoring situation?
Okay, come on.
If members of the community don't have an answer to that, then it must be that such medical monitoring has not been made adequately available to
Okay,
them.
sir, you asked a question, we'll get it answered, and we're not here for you to give us. If you have some information to give to us, I'd really appreciate
I
it.
just did.
Let the man talk.
Absolutely, positively. I just want the residents to also have.
You need to be monitored
Good
for
question.
asthma, increased asthma. You need to be monitored for respiratory difficulties. You need to be monitored for reproductive health problems. You need to be monitored for a number of medical issues which have been seen in other areas, such as the Gulf, where the BP blowout is still causing medical problems today. Thank you.